Hello, 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 everyone, and welcome to a brand new series as part of our Ask NP Deidre series. I'm so excited about this because this is going to be all literally about ladies' issues because that is nurse practitioner Deidre's specialty. And she is going to, in this very first episode, talk about the nutrient deficiencies for women over 40 and what you need to know. So, thank you so much, NP Deidre, for joining us. And why don't we just go ahead and just kick it off? What are the top most significant nutrient deficiencies facing women over 40?
Well, this is a good topic, and I do have to say, it's Mother's Day weekend coming up, so I'm glad we started doing some women's health topics. So,
Good
um,
timing. We're always about good timing, right?
we are. So, some of the top nutrients that we see in women over 40, just because, the body starts to change perimenopause and menopause. It can be from magnesium, vitamin D, B12, and iron. Those are kind of the top four that we see nutrient imbalances in right away for women 40 or over.
And so are these things that we need to make a list of? And every time we go into our primary care physician, that one main time for the annual exam every year, that you say, this is the list of vitamins that I want to check in my body to see if I'm deficient in them.
So that's actually a really good question. So vitamin D for sure. That can be drawn in a blood draw, your B12 also, and your iron. But magnesium isn't always best reflected in like a blood draw at all. So if you wanted to know more of am I magnesium deficient? We really look at symptoms. So if you're having muscle cramps or you're having constipation or trouble sleeping or feeling achy, things like that, those are some signs that you're deficient in magnesium. If your provider is going to do a magnesium blood draw, but you're still having those symptoms, I will tell you, oftentimes it doesn't show that somebody's deficient in the blood work. So your D, B12, and iron for sure, look at those ones, put those in your annual blood work, and let's see where you fall there.
And how do these deficiencies, or can you name which specific deficiencies of the ones that you mentioned, silently contribute to chronic health issues?
Yeah, so magnesium, it actually is kind of supports about 300 enzymatic reactions in the body, right? It can regulate your blood sugar, your blood pressure, muscle function, nerve conduction, and sleep. And so, specifically, when we're thinking about what's happening in women when they have perimenopause and menopause, so as we have hormone shifts, we start to become what I would say a little more metabolically unstable, right? Because these changes with this decrease in estrogen also can cause some changes in your lipids and changes in your blood glucose. So magnesium is really important because if we're looking at what can help our blood sugars, and especially at this vulnerable time when our hormones are starting to shift, I always say that's an important one just because of blood sugar regulation and blood pressure. Common signs of magnesium, like I said, muscle cramps, constipation, headaches, even. So, if you're somebody who's prone to headaches, you would definitely think you may be having some magnesium deficiency as well. And if you have blood sugar imbalances, so it's really important for that.
So, why is it that when women start transitioning into this perimenopausal, menopausal time, that the gynecologists, at the very least, don't take the preventative side or get ahead of some of these issues by saying, hey, we need to double check your blood every single year. And we need to especially look at, let's say, magnesium, because if you're deficient in magnesium, you have a tendency to see your A1C go up. You have a tendency to be more fatigued. You have other chronic illnesses that it can lead into. So we need to get ahead of it and we need to double check this now. Why? It's probably the $1,000,000 question.
Yeah.
Um, and this is really good that we're doing this, because I want everyone who is watching this to grab your notebook and take down some notes here and advocate for yourself and say, hey, doctor, I know this happens. And especially when you look at more than 50% of adults in the United States in particular, with either prediabetes or diabetes, this is something that we could take seriously. And this could be one of the reasons why. But yet, none of the endocrinologists that I know ever tell a patient, hey, we need to double check your magnesium levels. I
I
haven't
do
seen that one.
think that I sometimes think that we forget that vitamins and nutrients and minerals are so important to the body. Um, it goes without saying, like, we're looking at people thinking they are eating a diet that would provide this for them, right? And that oftentimes isn't the case, whether it be that we're not eating enough food or with the right kind of magnesium in it, or vitamins that we're missing, or that we're like the soil's depleted. And so there's so many levels to that, but we kind of assume, and I know I was not taught to check vitamins and nutrients that come with additional training and things like that. Other than vitamin D, we barely talked about, your vitamins and nutrients in my graduate program or anything. So you have to remember, like, physicians and practitioners, we get minimal training in like nutrition and how important it is. So it's a loaded
That's so
question.
frustrating. So we're very thankful, though, that you did the additional training. So I'm curious, would you mind sharing some practical ways in which we can incorporate some nutrient-rich foods into our daily meals so that we can make up for some of these potential deficiencies that we may be experiencing?
Right. So, food sources for magnesium, pumpkin seeds are a great source for that. Almonds, your spinach, black beans, always dark chocolate. We talk about that a lot. But the things that are going to kind of make you at risk after 40 of like not absorbing enough of these nutrients, specifically magnesium, is your stress. And women in their 40s are either, high in their careers and they're juggling a family, and they're juggling multiple things. And I say, like, when you're juggling things like that, we stop recognizing actually how stressful that is. But then the body starts to have some issues there. But your stress, alcohol and caffeine intake, and then those proton pump inhibitors that a lot of people are taking for acid reflux, or your diuretics, actually can deplete magnesium. And so there's some things that lifestyle wise and medications that can be causing some of this too.
Okay, so when is supplementation actually necessary for all of these different deficiencies that you may be experiencing? And you mentioned quite a few, from the B vitamins, the D, to the magnesium.
Yeah, so I would say you're supplementing when things are like, we have a lab and it shows that it's low, specifically your vitamin D. If it's showing low, then we supplement. B12, if it's low, we supplement. Iron, same thing. When it comes to magnesium, I'm typically looking at your symptoms. So supplement if you're having blood sugar, problems and there's imbalances. Supplement if you're having constipation, headaches, muscle aches, anxiety, trouble sleeping. That's when I would supplement. Magnesium is great to take at bedtime. And I know there's a ton of them out there, and you're probably like, well, which one? What does what? Magnesium citrate helps if you're having constipation. So that's a good one there. If you are having like blood sugar imbalances, the magnesium glycinate or bisglycinate or glycine is a good one for that. And if you're having anxiety or irritability or trouble sleeping, the threonate, THREONAT, because people always think I'm saying 3 and 8. So, but threonate would be good for that one. So I would supplement for symptoms for magnesium, and then with your vitamin D, looking at, do you have specifically for women? Okay, so what matters for vitamin D with women is we're looking at a range about 50 to 80 for our bone health. And so you're wanting to supplement to get you to that good range of 50 to 80. And so having your annual vitamin D checked would be beneficial for that.
We get asked this question all the time from patients that are concerned with supplementing with vitamin D and the buildup of calcium in their arteries. Is there any correlation between those two at all, or any way that they can mitigate any risk if that is an issue?
Right. So when you're getting your blood panel, looking at how much calcium that you actually have, because you might not need to supplement calcium. So I don't ever supplement calcium on somebody unless they actually are low. So when you get that comprehensive metabolic panel and it looks at calcium also, that's when I would add calcium in. Otherwise, I kind of stay away from it and just use vitamin D by itself.
Okay, so vitamin D is not the issue. I've had a few people that were concerned about that in particular versus calcium supplementation.
Right. And so I usually stay away from calcium if you're getting it through your foods, and we can tell that through the looking at your calcium levels, then I'm just like, you know what, you're doing a good job doing this. So I don't think we need to add any extra calcium. There is this small group of people with osteoporosis that may need additional calcium there. And so they have a little more specific needs because of the, wanting to support the bone.
Fantastic. Is there anything that we didn't cover in this first episode that would be really important in terms of the nutrient deficiencies that women over 40 experience that you'd want to address?
Well, the B12, I want to say a few things about that because your B vitamins are needed for your energy. And so a lot of times when we have reduced stomach acid, we're aging women, so we may be on acid blockers or metformin for disease states. This depletes your B vitamins, and B vitamins are linked to nerves. And so if you have neuropathies or tingling and things like that, get your B vitamin checked. That's really important part of that. And it's also needed for brain health. And so they've linked B vitamin deficiency to dementia and Alzheimer's. Like we see that often. So looking at that, and the full picture B vitamin isn't just a B12, but looking at your homocysteine levels, and methylmalonic acid would be another, to get the full picture of, are you pulling the B into the cells?
Right. It's not just about, okay, I have B in my system, but is it being absorbed? Is it being used by the body properly? And that's where the homocysteine levels, because if they're not being absorbed properly, those homocysteine levels, this enzyme in your blood, it goes through the roof and it's like nails on your artery walls. And a lot of people who have what's called an MTHFR mutation, and I know, and nurse practitioner Deidre is giggling a little bit in the background because I did have a doctor that said, why don't you just call it like it is, the mother effer gene, because MTHFR. But I still go back to the MTHFR, but it's a gene, and it makes it so you struggle with turning food into fuel. Your vitamin B is not absorbed, and so those homocysteine levels go through the roof. Both myself, my dad has it. Also, if you watch a lot of our videos on our channel, Dr. Michael Danzinger, who's a world-renowned diabetes reversal expert who comes on every single Monday to answer your questions, he also has it. So we talk about this a lot, and making sure that you do supplement with a vitamin, with a methylated vitamin B, and preferably one that is liposomal, one that goes under the tongue. Why is the liposomal so important?
So liposomal is a delivery. Anytime you're using supplementation of liposomal, you're getting it to the cell faster. So that's an important piece of that. Now, I will say the B vitamins, prescription wise, that are methylated, like your Metanex, that are prescription for neuropathy, they aren't liposomal, but the studies on those are really great as well of helping neuropathy pain.
My dad was prescribed that for the first time, but also thanks to you, we were able to get the Metanex for $60 a month versus $200 a month. It's not covered by most insurance, but even with his MTHFR mutation, even with his little cocktail that he has to have, a few times a week, we were told that if you end up drinking any alcohol within 24 hours of taking the B vitamins, they don't absorb properly. But I'm going to tell you, unless you do the liposomal, but I'm going to tell you that Medinex works and works so well that my dad's vitamin B levels are literally through the roof now. And that has never happened before. His homocysteine levels are normal, and he no longer has neuropathy in his feet. So and this is just after a few months of taking this. So at least from my experience with my dad, I'm a firm believer, and I'm surprised that it's not covered by most insurance. And I'm surprised that it took this long for my dad to get prescribed that. But thanks to Hope Vascular with Dr. Brian 𝗪𝗶𝗲 and Dr. 𝗪𝗵𝘁𝗀𝗍𝗂 over in Houston, they went right to it. And it made such a huge difference for them. But in our groups with the Global PAD Association, more than 12,000 patients across the globe, I don't know of any other patient that has been prescribed Medinex. So very surprising. But then talking to you, NP Deidre, you prescribe it to your patients.
I do. I use it all the time. And that's how I knew the pharmacy that specifically will get it for you cheaper is that brand direct. So I think it's important that we address vitamin and nutrient deficiencies in patients. And that one, Medinex is really helpful for neuropathy. And so we think as we age, we start to get those B vitamin deficiencies. And so that's an important one for cognition, nerve pain, things like that. So ladies, as we age, pay attention to your body and know that not always your symptom doesn't need a medication. There's a potential deficiency that goes with symptoms. It's your body telling you hey, I'm not getting something that I need.
And Catherine wants to know, she's watching on Facebook, what mineral deficiencies contribute directly to lower leg cramps with peripheral artery disease? I know magnesium is one.
Yeah, I would look at magnesium. I would look at your B vitamins for sure. And a lot of times to me, cramping or joint pain, if you have any joint pain associated with that, could be the vitamin D deficiency of that. And then making sure you're getting plenty of water and moving your legs as well.
Fantastic. Thank you, nurse practitioner Deidre. This was really fun. If people want to follow you, they want to learn more about your practice over there in Ohio, where can they go?
𝗪𝗵𝘁𝗀𝗶𝗲.com is our website. And then you can follow me on LinkedIn or Deidre Arms or NP Deidre on my Instagram.
And for more great videos such as this one, make sure you like this video. Make sure you subscribe to our channels. youtube.com/the@NP Deidre. You can also go to youtube.com/the@the way to my heart. And we look forward to more of these